Hello, my name is Amelia and I am one of the team of nurses who may be looking after you when you have your operation. I may have met you already at your pre-assessment visit. I hope you're comfortable and would like to invite you to sit back and watch this video, which will explain everything you need to do and know about your operation. But please don't worry about remembering it all. We'll go through any questions you may have before you leave and we'll give you full written instructions to take home. And this video is also available to watch on our website, so you can watch it again later when you're feeling more relaxed. If you're watching this video here at Vision Scotland before your surgery, a member of our team will be coming to take you through to theatre shortly. If you're watching this prior to your visit, this is what will happen on the day of your visit. A member of our team will make sure you're comfortable and explain any instructions for the duration of your procedure and make sure you understand what will happen over your time at the clinic. Once your surgery is finished, you'll be brought back to our lounge area for a drink and a biscuit. Our staff will be close at all times to ensure that you feel well and fit to head home. You'll either have a clear plastic shield taped over your eye or you'll be given one to take home. This must stay in place until the morning after your operation. If you're concerned that you might inadvertently rub your eye while you're asleep, you can wear it in bed for a few more nights if you choose. When you get home, please rest for the rest of the day. However, you can watch television, read, or use a computer or tablet. You may have some discomfort, so we would recommend taking regular pain relief. This should make any discomfort manageable. You can take any over-the-counter medication like paracetamol or ibuprofen, whatever you would normally take for a headache or similar. It is completely normal for the eye to be red, watery, gritty, and blurry. You may also experience some double vision. Please don't worry, this will all settle down over the coming days. Some people may experience the grittiness for longer, however this does settle over time for the vast majority of patients. When you get up on the morning after surgery, please make sure you wash your hands thoroughly before you touch your eye. You should gently run a cotton wool ball dipped in some cool boiled water across your closed eyelid, from the inner corner to the outer corner of your eye, like this. Remember to only use each cotton ball once. You're now ready to start your eye drops. You should have 2 bottles of these. The first one is chloramphenicol. This is an antibiotic and needs to be kept in the fridge. Pop 1 drop of this into the operated eye and wait a couple of minutes before putting a drop from the other bottle in. These antibiotic drops are to be used 4 times a day for 1 week. You'll get a chart where you can keep track of this with the paperwork that will be given to you to go home with. The second bottle of eye drops is called Pred 40. These are a steroid drop. These do not have to be kept in the fridge and you will use these drops 4 times a day for 4 weeks. As before, you'll have a chart where you can keep track of this. Give these drops a gentle shake and please be aware that they can sting a bit, but don't worry, this is completely normal. It is extremely important that you use these drops as prescribed. If you run out, please let us know and we can get more posted out to you, or for you to collect from the hospital. You'll also receive a GP discharge letter to inform your GP about your procedure. You can request a prescription for more drops from your GP if it's easier than returning to our clinic. You may also have been given some tablets to take. Please take them as instructed by the nurse. If you don't have any tablets, please don't worry, as not everybody needs them. You can now resume most of your normal daily activities. However, please wait for a full 24 hours after your procedure before you shower, bathe or wash your hair. When you do, be careful not to get any soap, shampoo or water in the operated eye. Also, please do not use eye makeup for at least 1 week after surgery. You must avoid strenuous activities for 4 weeks after surgery. This is to ensure that the pressure in the eye doesn't rise and gives the eye time to settle and heal. This includes activities such as heavy lifting, heavy gardening, strenuous sports and heavy housework. However, light activities such as walking, light gardening and housework are fine after the first week. Just be mindful of activities that may increase the amount of dust in the air around you. If the world seems very bright, just pop on some sunglasses whilst you adjust to your new vision. Please also avoid rubbing your eye for 4 weeks. You might find using a pair of ready readers helpful in the meantime, between surgery and when you go and see your own optician in 6 to 8 weeks. At this point, they'll measure your eyesight for any new spectacles that you may require. It is normal to see your own optician for your planned follow-up appointment. However, should you also wish to see a member of the Vision Scotland team for a post-operative check, please contact us and we'll be happy to arrange this for you. This is included in your package price. Bear in mind, you must be able to read a number plate clearly from 25 generous paces before you can legally drive again. You may fly after surgery, but it is important to only go somewhere where high-quality eye care is available. Our recommendation would be to wait a month before going abroad. As I explained earlier, it is completely normal at first for your eye to feel gritty, for the vision to be a bit blurry or even slightly doubled. Your eye may look red and might also be watery. These symptoms are all absolutely normal and you don't need to be concerned about them. However, there are some issues that we would want you to tell us about as soon as possible. These are pain or headache around the operated eye that is not eased by regular pain relief, nausea and or vomiting, if your vision is getting progressively blurrier rather than improving, if you experience visual disturbances, flashing lights, showers of floaters, or if you appear to have a curtain or a blind over a portion of your vision, or if you lose your vision. You should also let us know if you start to have any thick green or yellow discharge from the operated eye. We'll provide you with an emergency number to call should you experience any of these symptoms. I would also recommend watching our post-op symptoms video, which is also on our website. It's great for showing you what some of the most common post-op symptoms look like. We will go through any questions you may have before you leave. If you have any further questions once you've left, they should be answered in the literature we've given you. But if there's still anything that you're unsure about, please don't hesitate to get in touch and we will do our very best to answer the questions for you. Now just sit back and try to relax. And don't worry, you're in very good hands with the Vision Scotland team.